says up to 250,000 people will lose out.
Good morning, Mr. Poole.
This benefits agency video shows how independent doctors, rather than a patient's GP, will decide if they're fit to work.
I'm one of the doctors with the benefits agency.
Claimants will be assessed on how well they can walk, lift or carry. The government believes the number of claimants, 1.6 million, could be substantially cut.
People get onto the benefit in an inconsistent and haphazard way. I think most people in the country recognise that invalidity benefit needs reform.
Many GPs say they didn't like deciding whether a patient should get benefit. But many on invalidity benefit, like this man who injured his leg in a road accident 10 years ago, are worried.
You have to be virtually at death's door to be considered for this incapacity benefit.
While opposition parties predict thousands of genuine claimants will suffer, ministers insist that no one who is incapable of work has anything to fear.
Today, incapacity benefit will be worth less than the benefits it's replacing and is expected to save the Treasury more than £1 billion a year. Hundreds of thousands of people are expected to have their claims rejected, but the government says those who are genuinely sick and disabled have nothing to fear.
Protesters outside the Department of Social Security vowed to fight the introduction of incapacity benefit, which is likely to be denied to 250,000 current invalidity claimants. Roger Young from Kent is one who's likely to lose out. He hasn't worked since being crushed in an accident 4 years ago. A manual worker without qualifications, he's now been told by the benefits agency that he's suitable for alternative employment.
I can only stand for short periods of time. I can't walk great distances. So if the job entailed standing up, I'd have to take a break every 10-15 minutes. No employer's going to stand that.
Claimants will fill out this form asking such things as whether they can pick up a paperback book or a carton of milk. Then doctors recruited by the benefits agency will carry out a detailed medical test. The government says they'll be more objective than claimants' GPs and point out that in the past decade, the numbers on invalidity benefit have more than doubled to 1.6 million and spending risen to £7 billion a year at a time when the health of the nation has been improving. But critics say the new benefit is inflexible. Leonie Stewart-Mackenzie from Devon has chronic asthma and is often bedridden, but her condition varies. If she's well the day she's tested, she may not qualify.
I spend a lot of time unwell with great breathing difficulties, and the main problem as I see it is that I'm unemployable because my condition is fluctuating and there are times when I can work, but there's no rhyme or reason to it, so I couldn't even work part-time because I can't guarantee when I'm going to be well enough to work and when I'm not going to be well enough to work.
But the government says the new benefit will target resources at the genuinely sick and disabled.
We can only sustain and afford a social security system in the future if we make sure that the benefits it provides are going to the people for whom it was intended.
The real worry is not only those who will suffer by losing benefit, but those who in fact get onto the new incapacity benefit will also have very much reduced income, and the administrative problems are going to be chaotic.
They've also failed completely to take into account things like psychiatric illness. They're subjecting people suffering from mental illness to examinations by some doctors with no psychiatric qualifications at all. And I believe that the mentally ill are very likely to fall through the net.
Incapacity benefit is designed to weed out malingerers, but in the months ahead, critics will continually focus on alleged cases of unfairness. All the parties agree that something must be done to curb the burgeoning social security budget, which now accounts for 1/3 of all public spending. But by reining in this benefit, the government will inevitably face accusations that it's taking from the most vulnerable in society in order to pay for possible pre-election tax cuts. Fergus Walsh, BBC News, at the Department of Social Security.
Social Security. The incapacity benefit, replacing the old system of invalidity payments, will mean that all claimants face strict medical tests. The government says no one genuinely unable to work has anything to fear from the changes, but opponents say the new scheme will cause a great deal of hardship. As Judy Aslett reports, the new system aimed at budget savings is expected to leave thousands of people worse off.
Protesters outside the Department of Social Security this morning were fiercely opposed to the new benefit system. The government estimates that nearly 250,000 people will now lose their disability allowance and be classified under the new medical test as being fit for work.
People are really terrified about how they're going to be affected and that they're going to be called in for the medical test and given a point-scoring system which doesn't take account of their individual circumstances.
One man who's already failed a very similar test is Louis Gillen. He's been on invalidity benefit for the past 5 years after injuring his back at work. He's also an epileptic, which means that he has to take medication which makes him drowsy. Epilepsy is a condition that's not specifically defined by the test as grounds for receiving incapacity benefit, which means that the doctor who examined Mr. Gillen was able to declare him fit.
He was a GP. He was not a specialist of neurology or of bone structures or mental problems or whatever. And how he could make an opinion based on his limited knowledge as a doctor, or a GP should we call it, I don't know.
The result is that Mr. Gillen has been told to look for light work, but so far he's had little success. At 51 and with a bad medical record, employers he's approached so far have been reluctant to give him a job.
The response I got from one, after about pursuing this fellow in the personnel department of one hospital, was, "I'm sorry, don't waste my time. I've got between 3 and 3.5 million people out there looking for jobs, and you come along with a health problem, and you expect me to take you on?"
This video was given to us by the DSS after we asked to see the new medical test being demonstrated. We were denied permission to film an examination ourselves.
Do take a seat.
The specially trained doctor in the video starts by asking the patient a few questions, but as soon as it came to the examination, the video fades to black.
What happens now is
It's this grey or black area surrounding what the test entails and whether it will include certain disabilities like migraine that makes some concerned that it may not be fair.
It's difficult to see how a condition like migraine would fit into a functional test. That's a condition that we are concerned about, as indeed are certain mental illnesses and conditions that fluctuate, for example, multiple sclerosis.
Basically, nobody who has a real disability has anything to fear. Over half the people who are involved in this won't actually have to have a medical at all, because it's so obvious that they're disabled. And of the other half, they will have fair tests made that will make sure that those who are properly disabled and cannot work will get the benefit.
The government says it's changing the benefit system because it believes too many people are making unjustified claims, and doctors have been blamed for using the disability allowance as a way of writing patients off into early retirement. It's a charge GPs deny.
I would refute that criticism entirely. The government made the rules, and indeed only 2 years ago, when they wished to reduce the numbers on unemployment benefit, they were sending people round with the most trivial of illnesses to GPs for sick notes, so that people would go on to the sick benefit and not be shown on the unemployment statistics. Of course, they would never be sent round with a written request for this, it was always verbal.
As well as restricting the number of people who qualify, benefits for disabled people are also being cut. Jane hopes she will pass the new medical test because she has a bad back and suffers from severe migraine. But anyone with a similar condition who claims benefit under the new scheme would end up with significantly less money.
If I were to go on to incapacity benefit tomorrow, I would not get the £27 a week that I now get for the earnings-related supplement, which is the SERPS part of the incapacity benefit. That is now taken off, and of course my incapacity benefit would be taxed.
With disability campaigners showing themselves more than ready to take to the streets to make their point, the worst fear for the Social Security Secretary must now be that in the popularity stakes, the new benefit could end up in the same league as the Child Support Agency.